So what's the big deal about the psoas? Well, it's a muscle that is very frequently involved with low back pain. And it is very, very difficult to stretch. So I had a video before with a one-person stretch. You can do it yourself. And it's a good stretch, but it's a little bit limited. And people wanted to know, how do we get more in depth and how do we get to the upper part of the psoas? So we're going to show you that. This is a two-person stretch. And you want to pay close attention because you don't want to hurt the person. If you're working on a 25-year-old athlete, it's maybe not, they're pretty sturdy. You can crank pretty well. On most people, you want to be very careful, especially people with low back pain. So we're going to show you how to do this very, very carefully. So if you can get on the table about a 30-degree angle, you want one side of the hip completely off the table and the other one on. Then you lay back, you grab this leg, and then you want to have the person pull the knee up far enough that the back gets flat on the table. Now you're moving the origin of the psoas muscle away so that we can stretch it better. The difficulty is that it crosses so many joints and you have to stabilize all the joints involved before you can actually stretch the muscle. So I'm going to come in and I'm going to support here and I'm going to watch her trunk to make sure that it stays put. So if someone is really stiff or in a lot of pain, you want to start with the leg up here. Even that can be a stretch for them. And then from here, you have them push up very gently against your hand. So apply just a pound or two of pressure. And you want to hold that for about 10 seconds. And then after 10 seconds, you have them relax and you grab the leg and you lower it. So relax this leg and we're going to lower it toward the floor. So you don't push on it, you don't apply any pressure, you just let it go down. How is that? Is that tolerable?
Mm-hmm.
You're getting a pretty good stretch?
Yes.
Yeah. So she does have pretty tight psoas, and even before we're at horizontal, she already gets a stretch. So I'm going to put my hand on the knee and just add a couple of pounds of pressure here. And you want to check with the patient that on a scale from 1 to 10, where 10 is excruciating pain, you want to kind of keep it below a 6 or a 7. So we're still good?
Mm-hmm.
All right. So now go ahead and push that knee up again. And while you're pushing, take a deep breath in and hold. And keep the tension, feel the tension. And then relax, breathe out, and let that knee drop a little bit further. Perfect. And I can feel that leg giving. At the same time, I keep an eye on the trunk to make sure that we're not actually just pulling the low back off the table. We want to keep it flat so we're actually stretching that muscle. And for a first stretch, I'll probably leave it at that. So now I'm going to grab her leg. I'm going to tell her, don't lift it. I'm going to lift it for you. So we'll lift it up. We'll roll the person on their side. And we'll help them come up sideways. Okay? Perfect. So then it works the same, stretching the other side. Then you get on the other side of the table. You could do this on a kitchen island. It's difficult to do on a bed because the bed is too soft. You need something pretty firm. And other than that, just be careful. Pay attention to the person you're doing it on so you're not hurting them, and go really nice and slow. Keep in mind, you stretch it a little bit, you contract a little bit, you stretch it again. Thank you so much for watching. Use it carefully and hit that subscribe button so that you can stay tuned for more instructional videos. Thank you.